Hello, everybody. I'm Brad Parkinson, and welcome to episode 3 of Planet Health Radio. I'm joined today by my partner in health and well-being, the illustrious, the excellent, the most wonderful practitioner in the world, Shannon Burford. How are you, Shannon?
Thanks, Brad. What a build-up. How are you today, Brad? You're sprightly and alive today, Brad.
Excellent. Even though you're at home today and not in the office yet, I must say, and you're a few hours behind me anyway, so you can take your time. Look, we're going to talk today about food allergy testing, food sensitivity testing, which quite often gets missed and classed as a food intolerance test, which is not quite correct. And we're going to talk about food intolerances as well, a little bit about the controversy, and try and give a little bit of background on the different components to the tests and why they might be beneficial and whatnot. So Shannon, the difference between allergy, sensitivity and intolerance. Want to go into that a little bit there, and I might add my 2 bobs worth after you. Who says Bob anymore, by the way? I don't know.
Yeah, there is a crossover of all of them, but the classic allergy is, of course, child eats the peanuts and they get an immediate closing of the throat, and there's a histamine response, and they get a hives or welts. And classically, the allergist would invite you along, and they do a scratch prick test on the back or on the arm and expose them to certain substances, and often find an allergy to dust mites or peanuts or particular foods, and then rate that histamine reaction and that size of the welt as an allergy, and that would be classed as a typical allergy. Mm-hmm. And the second one was sensitivities. So there are different components of the immune system, and the immunoglobulins are made up along in different tissue. For example, the IgA is 70% of the immune system along the gut lining. And this is more of a slower reaction. You may eat a food, or you may be exposed to cockroach allergen in the dust, and then your mucous membranes will react to that slowly and create an immune response, which is an inflammation.
A sensitivity, wouldn't it, as opposed to the immediate allergy response?
Yeah, because it's not immediate. Yep. Even though it is part of the immune system, it's more of a sensitivity. Yep. And then an intolerance is often confused, but there are some similarities because there's never one thing going on. But the intolerance is more of an intolerance to salicylates or an intolerance to caffeine. The classic is caffeine, where some people will say, I can drink as much caffeine as I want and I can sleep, it's fine. And other people say, I drink a cup of coffee and I'm all jittery. Yep. That's more of an intolerance.
Mm-hmm. All right. Well, I guess probably leads me into the next question next part of this talk in regards to the immunoglobulins that are involved, because you spoke of that immediate reaction, the potential for anaphylaxis in severe cases. And that's definitely an allergy response. And then the sensitivity, that allergy response would be an IgE reaction, immunoglobulin E. And then the sensitivity that you spoke of, in particular with IgA along the mucous membranes, that's IgA, and that's a sensitivity. But in addition to IgA, we have IgG, and we have IgG 1, 2, 3, and 4, and they represent the majority of a lot of the food allergy tests out there. And this is where things get a little bit confusing as far as when results are reported, and we'll talk a little bit about that in a second. So the IgE allergy response, IgG 1, 2, 3, and 4, and IgA for sensitivity. And with regards to intolerances, the whole idea of an intolerance is you do not have an immune response. Necessarily, it's not something we can detect. We don't get an inflammatory response. Whereas the IgG and IgA, there's usually a delayed inflammatory response, you would say, and onset of symptoms can be delayed. And then the IgE is usually an immediate response, that histamine response. Okay, well, that's. I hope that people are following that. Okay, and it does get a bit confusing. It's you get different information from different sources, and then when you hit the literature too, it's can get a little more confusing. But hopefully we can clear up some of that confusion as well. I just wanted to note too. You mentioned the skin applied antigen scratch tests. And they're really good at environmental antigens. And I believe this is due because when we test in different areas of the body, there's different mucosal surfaces or mucous membranes in particular. And the scratch test will often give off a different result to testing a blood serum test with an IgG as well. So there's discussions on whether one's better than the other, but as far as what I've read, the scratch testing can be very good for environmental pollutants and is done by GPs or specialists in the conventional medicine field. However, for the food allergens, the IgG immunoglobulin test, when done correctly, can be a better indicator than your scratch test for your food allergens.
Definitely.
Now, just I think this is a good time to sort of move into the controversy of IgG testing as well, immunoglobulin testing, immunoglobulin G. As I mentioned, there is 4 different types of IgG. IgG 1, 2, 3, and 4. And in a lot of cases, a lot of testing, there's no real differentiation between those immunoglobulins. And IgG4 is usually what's cited in, as when people are talking about controversy with this sort of testing, they're really referring to some literature out there that's based on IgG4 testing. And IgG4 is about 5% of the immunoglobulin G protein. So it's really inaccurate way to assess this sort of testing. And a lot of the controversy stems from that. And then there's a lot of sites you can pay next to nothing and you get this test done, and they're basically testing IgG.
Right.
When they report those results, they're quite often inaccurately reported too. So, but look, a lot of allergy and immunology sites are reporting all sorts of the negativity around this, a lot of this testing, or saying it's not very sound. But there's obvious reasons for that, as far as I'm concerned and what I see. What are your thoughts on the whole controversy of this sort of testing?
Sure. I think part of it is also the technology is fast-paced and evolving, and classic allergists, they've been doing it for decades. We should be focused also on immediate danger in anaphylactic shock. For example, my son had allergies as a young baby, and you know those allergies, but you want to go and test how severe they are. So these allergists have set up, and they're using older methods of diagnostics, and they're scratching and measuring. And then this new technology comes along. So the common thing is no, it's not relevant. And as patients come to see us, they're fully aware if they have an anaphylactic reaction against a nut or a particular food or egg. It's quite clear.
Yep.
But patients are more sorting us out for they having digestive disturbances or constant headaches or something else. So they're thinking that's an allergy. So they sort us out and think, well, I want to have an allergy test. So I guess there's kind of two sides to it. There's the clear science, but there's the current allergist
science.
emerging science, and saying that there's no such thing as, I've heard commonly, there's no such thing as IgA allergies. There's no such thing as those naturopathic tests for allergies. But the immune system is so complex.
Technically, if the word allergy is used and people are referring to IgG or IgA, then that's right. But if we say food sensitivity test, yes, well, then that's a whole different story. And no one really talks about that. They either talk about allergy or intolerances and couple all that together. That's why it's you've got to be very clear. Allergy is the IgE, sensitivities IgG and IgA, and which is what we're seeing is emerging as in the science now, and the ELISA, the enzyme linked immunosorbent assay, I think it's called. Now, why that's sort of relevant too. So, yeah. In addition to what you're saying as well, we haven't talked about this yet, is now what has been introduced and I'm excited about is the C3D complement protein, which is a distinctive inflammatory marker that can get tested now. I'm really looking forward to utilising this type of testing. Again, the technology is sort of advanced and the literature's come out with talking about these complement proteins and we can detect them, and having them being registering alongside an IgG or an IgA response, we can now say, all right, you've got, this is coming up as a sensitivity, and it's also got an inflammatory marker. So it is causing you inflammation. You really have to deal with this. And what that does, it tells us what's more significant and what we should focus on as far as dietary advice goes. And it should help also prevent, I think a lot of these tests come out, and I don't know if you've had this experience, but for me, I've had many patients come in and they've been told they can't have all these foods. Some of them are really nutritious, beneficial foods that they should be at least reintroducing if they are causing them trouble initially. And they stay off their food, especially if they stop seeing a health practitioner guiding them through. So it's a real dangerous thing. And I think that's a big issue when we talk about food testing. There are problems. And if you're not a switched on practitioner, or keeping up with the latest research and what's going on and the latest methodology with these testings, you're really going to fall behind, and you're going to really, I guess, chuck out the baby with the bathwater too here, just because we've had some issues perhaps, or there's been a little bit of controversy, but usually, again, it's based on poor analysis of results and maybe poor testing quality, which I've yet to experience. And it's silly not to keep advancing in this area and refine people's diets so they can live without inflammation and be happy, healthy people. So now we've mentioned everything we've basically been talking about is kind of centered more on the sensitivities and a bit about the allergy. What about intolerances? What's going on there, and what can be done to treat intolerances? As far as I'm concerned, the gold standard and probably the only way at this stage is to really look at elimination diets. But what's your take on intolerances, and maybe talk a bit about that and your experience in your clinic?
Yeah, that brings us to the complexity of the human body and how it's there are so many systems going on, and it's never one thing. So for us to neglect a healthy diet or neglect taking out a lot of processed foods with a lot of preservatives, then we're missing a lot. So by doing that, we're going to improve the intolerances. And getting back to some real solid foundations of supporting channels of elimination, like liver function. So my take on intolerances, well, some of them are not necessarily entirely accurate. A common one is that's thrown around. A patient will come and they've been told they have a sulfur allergy. Well, there is intolerance, but it's actually not even to do with the sulfur. It's the sulfation pathways in the liver. So I guess it's kind of unpacking what it is and then looking at what it is for that person and then treating that particular area to improve the symptoms.
Yeah.
I guess
look, I've had the sulfur thing a couple of times too, and it's quite funny. Well, your body's got so much sulfur in it, you can't be allergic to sulfur. And quite often that's in relation to different antibiotics. I think penicillin as well.
Oh, yeah, of course.
Yeah, has caused
all crossed in communication and confusion.
Yes, yeah. Well, look, it's intolerances too. I think probably to clarify that a little bit, things like tyramines, which we sort of rule out for migraine sufferers and so forth, like that, would fall into that. Your glutamates, because they're neuroexcitatory, so that means they're going to excite the nervous system and can disrupt things like sleep and so forth. So they're kind of like irritations to the system without really provoking an immune or a strong inflammatory response, really. And you can have your detoxification impairments by salicylates. And then there's obviously things like your preservatives, thickeners and emulsifiers and stabilizers. They can all affect different things. And we haven't even gone into the microbiome regarding to these things. I think that's where I think intolerances are, I think, where you do a lot of work on intolerances as well. And of course, at the end of the day, healing the gut overall and making sure your levels of secretory IgA or your mucosal layer is intact and so forth is all very important too. Well, there you have it. Food allergies, food sensitivities, food intolerances. Do you have any last thoughts with all that, Shannon?
Just maybe tips for people out there. Get back to basics and aim on working on your gut to help you improve your intolerances and get over some of those sensitivities.
Yeah. Now, there you have it. So improve your gut health as always. And if you have got some concerns with your gut health, go and see your naturopath. They're a specialist in that area, especially when it comes to food allergies and so forth. So Shannon, where can everyone find you?
Me, best spot is Cura Medicine, CURA medicine.com.au. And everything's on there. How about you, Brad?
And you can find me at bradparkinson.com.au and check out what our websites offer. And there's usually a lot more information on our websites regarding things such as food allergies we've been talking about today. So for Planet Health Radio episode 3, I'm Brad Parkinson, that's Shannon Burford, and thank you for joining us.
Thank you.